So the diagnosis that I will be talking about today is called DiGeorge syndrome. This is something I didn't know a lot about, and I experienced it during my first fieldwork experience. So that is the one that I chose. DiGeorge syndrome is a disorder caused when a small part of chromosome 22 is missing. If neither parent, or the chances of a child getting it, so like if neither parent has the syndrome, there's a 1 in 100 chance, or rather 1% chance that the child will get it. If one of the parents has it, that increases to 1 in 2 chance, or 50% chance that the child will get it. I was reading up on the chances and whatever, and they said that because of the symptoms, you can actually have it and never know that you have it. So I didn't see anything about how many people in the world have DiGeorge syndrome. However, it's kind of crazy that you could have it and never know and then pass it on to your children. So I chose this diagnosis as 2 of the boys at my first fieldwork site had DiGeorge syndrome, and they were also brothers. I don't know their family history, so I don't know if the dad had it or the mom had it or whatever, but I thought it was interesting that both the brothers had it. I also thought it was interesting how subtle their symptoms were and how subtle the symptoms can be in anybody with DiGeorge syndrome. So that's something I'll talk about later. So the signs and symptoms are heart murmur and cyanosis, which can result from the heart murmur, wide set eyes, cleft palate, delayed growth, underdeveloped chin, frequent infections, delayed or poor muscle tone, difficulty feeding, failure to grow, breathing problems, delayed development, missing infant milestones. One thing they mentioned was delayed and like rolling over and things like that. Delayed speech. They also said you could have a nasal sounding voice, which both the boys that I worked with had the nasal sounding voice. They also had the wide set eyes. They can also experience learning delays and behavior problems. I didn't notice much of the behavioral problems. However, both of them had a resource room. And so I wasn't in the resource room. I wasn't able to see like if they were having behavioral problems from the DiGeorge syndrome or if it was just general behavioral problems. They were both in the middle school elementary. So they're kind of older, 2nd grade, I believe, and I don't remember what the other one was in, but they were both older by the time I was there, and they'd been in services for a little bit. The prognosis varies from case to case. I was reading that some may die from it, while others will not. I did not see why they would pass away from it. However, I'm assuming like delayed growth and the infections and just whatever their body's kind of compromised. So those who they learn to manage their symptoms essentially. Occupational therapy treatment. So we did handwriting, typing, fine motor, gross motor, tying shoes. I also know like facilitating development, so like helping the child to roll over and things like that. And then talking about appropriate behavior, red light, yellow light, green light, things like that. For fine motor, we just did like therapy or things like that to get them warmed up. Some of the gross motor was like hopping, skipping. I know one of them had a goal for a 15-piece puzzle, so that was something that we did. Some adaptive equipment, I thought of as pencil grips or typing over handwriting. The evidence-based article I found was called Early Intervention in Children Ages 0 to 6 with a Rare Developmental Disability and the Occupational Therapy Role. This one looked at the importance of family-centered practice and the use of play. The study used cross-sectional mixed method approach using surveys and interviews for data collection. They found in reported intervention areas that play was the most frequently reported area of intervention, followed by ADLs, communication, gross motor, and fine motor skills. In this study, play was shown as the most frequent area of therapist intervention, and toys were the most frequently used intervention to help improve play. Early life home-based intervention programs have been shown to be effective with children with a wide range of developmental disabilities. They found family-centered practice has been shown to increase the efficacy of therapy interventions and provide much-needed support to the family. Now, this article didn't directly talk about DiGeorge syndrome. However, DiGeorge syndrome is rare, and we used, I don't remember for sure, but I think they were in early intervention, the 2 boys that we were working with. their family was involved, and I think they emailed the family or the school every day with updates and stuff like that. And they were also thinking about moving. So they were talking about the importance of like, it's okay. Like the boys were going through that transition and things like that. So, yeah, it was really interesting to work with the syndrome and to see like how subtle those things can be and the impact it can have on their life. So thank you.